we've got Chris Lynch, who runs an agency here in town, Virginia's health insurance agency. He's been doing Medicare-related things for probably 15 years, I guess. Is that? 2009. Yeah, 14 years. So probably has seen and done just about everything. As you all know, Medicare is it's a fantastic benefit. I think there's something like 65 million people now enrolled in Medicare. But like anything done by the government, it is a little opaque, can be very confusing. You've got Part A, B, D, Medigap, Medicare Advantage, all these different things to work through. So we're really glad to have Chris here to walk us through some of the basics of how to get into the program. And then if you're already in Medicare, he'll be happy to answer and talk about options there as well. So without any further ado, I'm going to turn it over to Chris. And please, I think he'll tell you this, but if you've got questions as we go along, let's make this interactive. Feel free to raise your hand, and we'll get questions answered as they come up. So,
absolutely.
Take it away.
Thanks, Wes, and thanks to everybody at Heartwood for coordinating this with me. I'm really excited to be here teaching this class with you guys. I know it's not the most exciting material, but it is very important. Just to start, can I get a show of hands? How many people are already on Medicare? Who's made that transition already? Okay, quite a few of you. All right. So this class is really, first of all, it's kind of designed for the people that have not yet made that transition. So a lot of what we're going to be going over here is going to be, geared toward people that maybe haven't turned 65 or are still on an employer plan. If you have questions as I'm going through this, whether it's about your current situation or moving to Medicare, as Wes said, please feel free to interrupt. I find that the more interactive this class is, the better for everybody, right? So really enjoy the questions, and I'm excited to be doing this live. It's been Zoom and virtual for so long that it's nice to get back in front of everybody. All right. So a couple of housekeeping things before we get started. This class does take a solid hour, so some of that will depend on the number of questions that you guys have, and again, really want to encourage those. Note-taking. So when I give this class live, I see everybody furiously scribbling down everything that I'm saying here. So a couple of things about that. If you're going to take some notes, that's great if you learn that way. The presentation will be available, I believe, so everybody will get an email of the slide deck. And then also, if you still want to take notes, concentrate more on the concepts that I'm presenting versus some of the dollar figures and numbers, because those change year to year. Okay? Class topics we're going to be going over: original Medicare. I'm going to discuss the two parts you get from the government, Part A and Part B. We'll go over those costs and coverages, how you enroll as well, eligibility. Touch base from a high level on the Part D drug card. That's a piece that the government does not provide, right? Medication coverage. And then high-level overview of the various supplements, Medicare Advantage plans. How do you fill in those cost gaps that Medicare leave you with? I like to start this class with just a simple definition. So what is Medicare and kind of who's eligible? So Medicare is a federally run health insurance program, and there are three sets of individuals that qualify. So those Americans 65 and older, right? You become eligible for Medicare by reaching 65. If you're under age 65 and you've been receiving Social Security disability benefits, receiving those benefits for 24 months, you become eligible the first of your 25th month. And then finally, anybody of any age, if you're diagnosed with end-stage renal disease, there's about a 4-month waiting period. Okay? And we're just kind of dive into the class here. And we're going to start with the two pieces that the government provides, and the only two pieces they deal with. I'm going to give you an understanding of Part A and Part B, what they cover and how they cover it. And what I'm going to say here assumes you don't have anything else other than original Medicare. So let's start with Part A. Part A is going to cover what most people will associate with an inpatient hospital bill. So here you've been admitted to the hospital, and now you're getting a bill from the facility itself. Note, it does not cover maybe the doctors, surgeons, anesthesiologists that come in and see you while you're in there. Here, we're talking about you're an inpatient, and now you're getting a bill from the facility itself. That's really what Part A is designed to cover. I've listed some other facilities, things like skilled nursing facilities, rehab centers, even some home health care. So if you're an inpatient at a rehab center, that would be a Part A covered service. For any of those type of facilities, I want you to think about relatively short time frame, okay? Medicare is not designed to cover you if you're going to go live in a nursing home on a permanent basis, right? You need to go live in a memory care unit. That is not something Medicare is designed to cover, okay? So relatively short time frame, you're going to go in, you're going to get better, and then you're going to go live on your own. So how does Part A cover that? Let's assume you don't have anything else going along with it. So no Medigaps, no supplements, no drug cards. What is Part A? What are you responsible for? First thing that happens, there's a deductible you have to meet. And the deductible this year is $1,600, $1,600. Now, that deductible is probably unlike any insurance, any health insurance you've ever had in terms of when you need to pay it. So it doesn't run off of a calendar year, nor does it run off of a 12-month period from when you sign up. So you actually pay that deductible every time you trigger what Medicare is going to define as a new benefit period. And they will tell you that happens when you go 60 days without a hospital stay. Okay? So here's the examples I use for people. Let's say you're admitted to the hospital, you're treated, you're released, you pay that deductible, and 2 weeks go by, and now you're readmitted. You haven't had a 60-day break, you're in the same benefit period, and you would not have to pay that deductible again. Let's say you're admitted, you're treated, you're released, you pay that deductible, 61 days go by. You go back into the hospital, now you're in a new benefit period, and you would pay the deductible again, right? So the point here is multiple benefit periods potentially during the course of each calendar year, anytime you have that 60-day break. Next trick with that deductible is it will cover your hospital stay at 100%, but there's a limit to the number of days that that coverage will be allowed, and that is also 60 days. So you can be admitted, pay that deductible, you're in the hospital for 60 days, you're covered at 100%. If you are still in the hospital after 60 days, you then become responsible for a daily copay. You can see there for days 61 through 90, you are charged $400 each day. And if you're still in the hospital after 90 days, days 91 and above, that copay will double to $800 per day. All right? In terms of the maximum that you're responsible for? No, sir. So it's $800 a day for days 91 and above. What's interesting, though, is there is a lifetime limit to the number of days Part A is going to cover you. This gets a little confusing, but it's basically 60 days. Think of kind of a side reserve tank of 60 days. Any day above a 90-day hospital stay reduces that reserve tank by a day. And then once that 60 days is depleted, Part A will no longer cover your hospital bill. You're on your own. All right? Now, it's difficult to get there. So, example, let's say you're in the hospital for 91 days. Now you've got 59 days left in your reserve tank. Now you're released. If you go 60 days and you're in a new benefit period, you don't immediately deplete that 59 days you have left. You start over with the $1,600 deductible. Okay, now you've got to get to 91 days again, and then you've got 58 days left for your lifetime. Everybody good on that? Okay. So that's Part A, that's your inpatient portion. Now let's talk about the only other piece the government provides, Part B. It's what I'm going to call the professional services. Medicare calls it medical. So here, let's think about everything like your primary care and specialist visits. all of the diagnostics that those doctors could order, so your lab work, x-rays, MRIs, CAT scans, all of your outpatient services, so surgery, chemotherapy, emergency room visits, mental health, preventive health, right? That's all Part B. Basically, I tell people if it's a bill and it's not coming from an inpatient hospital stay and it's not a medication, with a few exceptions, it should be falling under Part B. Okay, so we got a very wide-ranging set of services here. So how does Part B cover that? Comes with a deductible as well. This works a little bit differently though. Deductible is relatively small. This year it's $226. Actually went down this year. So last year it was $233. This year it's gone down to $226. Just to keep you on your toes, that deductible does not work the same way as Part A. It's a calendar year deductible. So no matter when you sign up, that deductible is going to run January 1st through the end of December. Trick here with this one is it is not 100% coverage after you've met that deductible. It's going to turn into an 80-20 plan. So Part B will cover 80% of your bill. You will pay 20% of your bill. Unlike any health insurance you've ever had, there is no maximum cap on this 20%. You're going to pay that 20% to infinity. Okay, so we've got unlimited risk exposure here if you just have Part B. All right, a little more straightforward on that one. Any questions on B?
Can you back up one slide there, please?
Yes, sir.
So, one more slide about transport. So if you are transported by ambulance to a hospital, they cover that.
Yes, sir.
But if you live in assisted living or memory care and you have to go home and you don't have a transport via a friend or a relative, they don't cover that.
No. So transport, yes, sir. Oh, yes. So the question was in regards to transportation. So Medicare itself, A and B, covering what we would consider routine transportation, maybe from your home or assisted living facility and to a provider, right? You got to go to your doctor, you got to go somewhere. That is not transportation that Medicare is designed to cover.
Or you come back from an emergency room?
No, sir. So even if you came back, the question was if you come back from an emergency room. So you get admitted to the emergency room and now you need transportation back home, that is not something Medicare is designed to cover. Okay? Yes, sir.
Maybe you're going to cover it. The premium for A is 0. The premium for B is suggested gross income, isn't it?
Yes, sir. Good question. So that question was regarding the cost for Part A and Part B. I do go over that a little bit later, so it will be helpful if we can just hang out for a second, and we'll hit on those costs on some next slides. Okay? Let's see where we're at here. Okay. Some of the next few slides, in my opinion, some of the more important ones for individuals. It's all about when do you become eligible, how do you sign up, should you sign up? Okay, this is not straightforward for everybody. So the most important window for enrollment is the window 7 months centered around the month you turn 65. So that is 3 months before the month you turn 65, the entire month you turn 65, and then 3 full months after you turn 65. So this is everybody's initial enrollment window, right? Now, if you are drawing, you're an individual and you're already drawing the Social Security check prior to turning 65, you are on the government's radar, and they will automatically enroll you in Part A and Part B, both pieces. Normally get your card 3 or 4 months before you turn 65. I think what they require is you've got to be drawing the check 4 months before you turn 65. Okay? Then you're going to be automatically enrolled. You'll get a Medicare red, white, and blue card in the mail. There may be reasons we'll go over in a minute where you might not want either or both of those pieces. So you got to be cognizant of that. If you get automatically enrolled, it might not be something you want. Now, if you're not drawing Social Security, there are some steps you've got to take. You got to be proactive. You got to let them know if you want to enroll in Medicare. By far, the easiest way to do that these days is online at ssa.gov. That is the Social Security Administration's website. Social Security handles your enrollment in Medicare. Okay? You can, if you're a glutton for punishment, go down to the office, right? You can call them, and they'll schedule an appointment with you a month out, right? And then you'll call again and go through the application. But if you're at all comfortable with a computer, do it online at ssa.gov. By far the easiest way. Now, the timing of when you do this is going to affect when your Medicare starts. There are some rules regarding when your Medicare starts based on when you enroll. If you enroll one of the 3 months prior to turning 65, your Medicare starts the first of the month that you turn 65. There's an exception to that rule, which is if your birthday falls on the 1st, your Medicare is going to start the first of the previous month. Okay? If you sign up during the month you turn 65, then your Medicare is going to start the first of the month after that. And it works that same way now. It used not to work this way. But now if you use any of the 3 months after you turn 65, your Medicare is going to start the first of the month after you submit the enrollment. And we've seen some interesting things with this. If you go out there and start an application on ssa.gov, don't finish it, and then go back later and submit it, they will use the start date as the date that they're going to assign you to start. Okay? Right? So it can be a little bit tricky there. All right. So that's how you sign up. Let's go over a little bit regarding if you should sign up. So get calls all the time. You know, Chris, I'm turning 65. I know I've got to sign up for something. I got to register somewhere. I got to tell somebody something about this. Not necessarily. So this window, the 7-month window, is very important for individuals if they're not going to continue to have qualified health insurance from an employer. Right? So a couple of things about that. Your employer, if you want to delay Medicare, your employer needs to have more than 20 employees. That is the key regarding who's the primary and who's the secondary payer. So if you're going to continue to work and your employer doesn't have more than 20 employees, then you've got to go ahead and take Part A and Part B. Because your health insurance carriers are going to start paying your claim as if you have A and B, whether you do or whether you do not. So you effectively, if you don't take A and B and you stay on your employer plan, it's less than 20, you've self-insured the portion that Medicare itself would pay. Okay? Now, let's assume your employer's over 20 individuals, and the next important thing is that the health insurance you're on, it provides qualified coverage, creditable coverage for your medication portion. That's the important piece. So the portion that your employer plan is going to pay, it meets Medicare's standards for prescription drug coverage. Okay? So more than 20 employees, credible drug coverage. If it's a better deal for you to stay on the employer plan, you can do so. You don't have to sign up. You don't have to register. Just maintain that continuous coverage. And then whatever time it is in the future you want to move to Medicare, you can do so with no issues, no late enrollment penalties, no problems. Right? Okay, let's talk about delaying or taking both of these pieces. Even if you're on an employer plan and you decide to delay Medicare, most individuals will go ahead and take Part A. It's the inpatient hospital bill. Reason they'll do that, it doesn't cost anything. So there's no monthly premium for Part A. It would be a secondary payer if you got admitted to the hospital. There's one issue you've got to be aware of, though, which is if you're on a high deductible health plan and you're making tax deductible contributions to a health savings account, then by IRS rule, if you want to continue that, you've got to skip both Part A and Part B. You cannot take Part A and continue to make the tax deductible contribution. Let's say you're an individual and you decide to do that, which is great. I love HSAs. No problem there, but what you've got to be aware of is the timing of when you're going to stop that contribution. So Medicare has a rule. If you're over age 65 and then you sign up for Part A, by rule it gets backdated 6 months. So let's say you're 67, you've been on your employer plan, You've been contributing to that health savings account. Now you're ready to move to Part A. When you enroll, they're going to backdate that effective date 6 months. You don't have any choices here. It's automatic. And now you've been making illegal HSA contributions that entire 6 months. Okay? So the reality is we typically advise our clients at least 8, if not 9 months before you know you're going to move to Medicare, stop the HSA contribution. Because the reality is you've got to start the process 2 to 3 months before you know you're going to move. So 6 months worth of backdating, 2 to 3 months ahead of time is when you got to submit the application. Stop that HSA 8 or 9 months ahead of time. Okay? That does not apply if you're going to enroll in Medicare when you're turning 65. So there's no backdating there. So you can contribute all the way up to when you turn 65 if you're coming off the employer plan and moving to Medicare at that time. This is only a problem for individuals that are past age 65. Okay? Everybody good? I'm getting yes.
Give an example for if you're not 65 and you're not employed.
So the question is, if you're not 65 and you're not employed,
So I'm paying out of pocket. I retired early, paid out of pocket, brutally expensive. Thank you very much. And I'm contributing to an HSA. So if in July 1 of next year I hit 65, am I eligible to make HSA contributions next year?
yes. So the question is, if you're going to turn 65, you're not going to stay or you don't have eligibility on an employer plan, what are you eligible to do in terms of the HSA contributions? You can contribute a prorated portion until the time your Medicare starts. So prorated. So for example, you turn 65 in July, your Medicare is going to start July 1st. You can contribute a prorated amount all the way up through June. Okay? Okay. Part B, so while some people who don't have that HSA issue, they'll go ahead and take Part A, most people will go ahead and delay Part B. The reason for that is there's a monthly charge. And if you're going to stay on your employer plan, it's a primary payer, you typically don't want to be paying the government for Part B when it might not do so much for you. Okay? So let's play this forward. You're over the age of 65. You're ready to come off your employer plan. Now you either have A, because you didn't have an HSA, or you're going to enroll in that, right? So you get Part A done first. You can't do A and B at the same time if you're over 65. So you're going to make sure A is done first. Once that's done, you've got some forms that you're going to send in to the local Social Security office. One of them is going to be a form that you fill out. Hey, government, here's when I want my Part B to start. The other form, however, is a form that your employer is going to fill out, and they're going to sign it, certifying that you've been on continuous creditable coverage going back to at least age 65. And you're going to send those into your local Social Security office. And the government, not the fastest entity on earth, so that's why you got to start this process, 2 or 3 months before you know you're ready to come off. Okay? They do give you a window. So if something happens and you fall asleep at the wheel and your employer coverage ends and you haven't done anything, you actually get an 8-month window to pick up Part B with no late enrollment penalties. Okay? Reality is nobody ever uses that because they don't want to break in coverage, but if something happened, or the more likely scenario, let's say your employer decides that they're willing to offer you coverage on COBRA and they're going to pay for it for a few months, and you want to delay Medicare for a little while you get the covered COBRA from your previous employer, that's a more likely scenario. But you do have an 8-month window from the time your employer coverage ends, you can move to pick up Part B. Okay? All right. Got those 2 forms. One little note here I've seen happen. Sometimes when you're over 65, maybe you've had multiple employers. You do have to go back and get each of those employers to certify the coverage back to age 65. I had somebody who became eligible for Medicare in the 80s due to disability, and they had to go all the way back. It was like 5 employers. It was a mess. Okay, let's say you're an individual and you've delayed Medicare, you've been on your employer plan, now it's time for you to come off. We advise calling this number. This is the Medicare Benefits Coordination Recovery Center. When your employer plan ends and Medicare starts, call those guys, let them know, hey, you know, your records show that I'm on an employer plan anymore. I am not. I've transitioned to Medicare, and that will save you some headaches with your claims, because what's supposed to happen is this information will feed over to this entity, but it doesn't always happen very quickly. Sometimes we've seen it not happen at all. And if you don't do this, you go in, let's say 2 days after you've stopped that employer plan, your claim could get denied because Medicare still shows you on your employer plan, right? So just be proactive, call that number, let them know. If you're turning 65, again, this really doesn't apply to you, shouldn't be a problem. Okay? All right, here we go. Slides with information about the cost of these two pieces. We're going to go over both Part A and Part B. Part A, you can see there, comes at no cost. You do have to qualify, so you've got to have earned enough Social Security credits. I was in one of these classes. I used to say it was free. Then somebody jumped up and told me, no, I've been paying for that my whole life. Right? Correct. It came out of your paycheck. So it comes at no additional cost to you at this point. Okay? All right, Part B, however, is not zero premium. It comes with a standard monthly charge. Everybody this year is paying at least $164.90 a month. That actually went down as well. So for those of you that are already on it, you know, it was $170.10 last year. Went down a little bit to $164.90. I think I've seen that happen 2 times in the 12 or 14 years I've been doing this. Okay? If you're drawing Social Security, that amount comes out of your check. You do not have a choice, right? The government's going to get their money first. So you're drawing Social Security, comes right out of your check. If you're not drawing Social Security, you've got a few different options to pay this. By default, you're going to get a bill in the mail. So you're not drawing Social Security, you get this bill. If it's just the standard $164.90, the bill's going to come in every quarter. So once a quarter, once every 3 months, you're going to get a paper bill in the mail. If you don't like that, a lot of people don't because it's a relatively big bill, $500 so, you can go to Medicare.gov, so .gov, not .com, Medicare.gov. You can enroll in what they call Easy Pay, so they'll start drafting it out of your bank account. They'll even let you pay it with a credit card. I don't think they auto-draft the credit card, though, do they? They do not auto-draft the credit card. So if you want to pay with credit card, you can do it manually online each month, right? Everybody's good at racking up those points these days, okay? But we typically advise get it on some sort of automatic, charge, automatic payment. Everybody retires. You guys want to go travel. You don't ever want to lose any of this stuff due to non-payment. That can be a mess to get back. Okay. Let's talk about some of the high income adjustments. They've already been alluded to here a little bit. So I said everybody pays at least the $164.90. It could go up based on what your income is, right? And Heartwood's doing a great job. Everybody's going to be eligible for these high income adjustments, right? Okay, so our thresholds this year. Single individual, $97,000. If you're married filing jointly, $194,000. So if you're below those 2 income thresholds, you just pay the standard $164.90. All the figures we're going to go over here are per month per person. Right? Medicare is not husband and wife. Those plans don't exist. Okay? So everything per month per person. You can see as we start crossing those income thresholds, your Part B gets more and more expensive. Let's just use an example. So you're an individual, you make $100,000, or your joint, you make $200,000. Your Part B is increased to $230.80 a month. Okay? You can see that gets more and more expensive as you go down. If you're in the highest income bracket, $560.50 a month per person per month, just for Part B. There is a category there, married filing separate. You can see what they do to dissuade you from doing that. It basically, once you cross, if you're an individual and you're filing separately, once you cross the minimum threshold, they've done away with the first 3 steps up the ladder. Now you're all the way down to your Part B, charging $527.50. I'm not a CPA. I don't know if that makes sense for individuals or not, but could be something worth looking at. We haven't talked about the drug card yet. This is a piece that the government does not provide. However, if you're in these high income brackets, they're going to charge you an additional amount when you go get a drug card. Okay? So you're going to go out and you're going to get a drug card from a private insurance carrier. They're going to provide your prescription drug coverage, and then the government's going to come in and say, oh, look, you make all this money, and they're going to basically surcharge you. Right? Same thresholds. You can see your plan premium over on the right. If you're below those thresholds, you just pay whatever your drug coverage costs to the carrier. Once you cross those thresholds, there's your additional amount per month per person that the government's going to charge. Let's go over how the government calculates these numbers, okay? So they use your tax return from 2 years ago. So somebody signs up in 2023, they're going to look at your tax return from 2021, send you a nice letter. Congratulations, you're a high income earner. Here's how much more you owe us. Now, they do review it every single year, always looking 2 years in arrears. So you sign up and you're not locked into that high income forever. 2023, they're going to use 2021, 2024, they'll look at 2022, so on and so forth. Here's the trick with this, the thing you want to be aware of. If your situation is different the year you're signing up than what they're looking at 2 years ago, do not let it wait 2 years for them to catch up to your lifestyle change. There's an official appeal form that you're going to fill out and send in to your local office. And we typically have our clients, as long as you've got a valid reason, so think about work reduction, retirement, marriage, death of a spouse, loss of income producing property. There's 7 or 8 of these categories they're willing to accept. But if you've got a valid reason, submit this appeal form. All they can do is say no. But again, we typically have our clients be pretty successful at getting this removed. Now, if your income's going to be what they're looking at 2 years ago, you're stuck. Really not much you can do there. Okay? That kind of wraps up our first section, the original Medicare section, right? So here you're not really restricted to a specific network of doctors. Any doctor anywhere that takes Medicare, you can go there. Remember that unlimited risk exposure? I think one of the biggest gaps is that 20% with no maximum cap on it. A and B do not cover any prescription meds. Like inpatient infusions, chemotherapy, that's different. But I'm talking about you're going to your CVS, Walgreens. Medicare A and B does not offer that coverage. And then currently, as it stands right now, there's really no coverage for any of these ancillary services. Dental, vision, hearing aids, A and B does not cover that. Certainly, again, I want to drive this home, it is not long-term care insurance. It's not going to cover you in a nursing home on a permanent basis. Okay? All right, everybody good with A and B, original Medicare? Any questions before we kind of switch gears here?
So I have a question, just for clarification. The drug card you talked about, once you sign up for B, you're going to pay for it regardless. Even if you do an Advantage plan or anything like that. The way you explained it, I understood it is whatever the charge was going to be for B, and then you would get charged for a drug card together.
So the question is regarding some clarity regarding the Part B and Part D high income adjustments. Okay? All right, very good. So when you go on to Medicare, you've got no choice but to take both Part A and Part B. Okay? When you do that, you're going to get those high income adjustments based on being enrolled in Part B as a separate high income adjustment than the Part D drug card. The only way you get charged the Part D high income adjustment is if you have some form of Part D drug coverage, which is not a requirement. So if you're an individual and you don't get a Part D drug card, or you don't get a Medicare Advantage plan that has the Part D drug card built into it, you do not get charged the high income adjustment for having a drug card.
But if you do have an Advantage plan that has the drug prescription part to it, you do get charged.
Yes. The question is, if you have a Medicare Advantage plan that has drug coverage built into it, do you get charged the Part D high income adjustment? You absolutely do. Yes. Yes, sir.
Suppose you don't have a Medicare-related plan, you just have a high deductible health plan. You just kept it of your former employer, probably because they paid a big part of it. So, and it covers drugs, always had covered drugs, still does. But I never had to apply for a separate card. There is no identifiable card. Aetna does seem to pay drug charges. Is that okay? Does that trigger the premium?
This is the question is, I believe, regarding a retiree plan and its built-in drug coverage.
Yeah, when I left the federal government, I had the option of just retaining my existing deductible health plan under the same terms. So the government was paying roughly half of it, so it was a pretty good deal. B was very expensive for me.
Yes.
So I did not elect B, so I never had B.
Yep. So we're talking now, the question is regarding specifically federal retiree coverage, right? You are in a very unique situation. The retiree coverage available to federal employees is the only retiree coverage that does not require you to get Part B. So anytime I've ever sat down with somebody and looked at this that had that as an option, they did just what you did. They skipped Part B and chugged along with their federal program, the Federal Employee Health Benefits, right? FEHB. Yes. Yep. Not unusual. Yes, sir.
Similar question. I'm on a retiree medical plan that I contribute to since I retired. So will I automatically get B with A? I'll turn 65 at the end of this year.
You will. The question is, he's got a question regarding his retiree plan if he requires Part B. I don't know why you wouldn't be required to get Part B. Every retiree plan outside of the federal government that I've seen has always required you to get Part B because of the coordination rules. They want Part A and Part B paying their cost, their share first, and then the retiree plan paying. There's maybe some rules regarding that that could change it. But my expectation would be yes, you've got to pick up Part B. Yes, sir. Okay. Everybody good so far? All right. We will carry on now, kind of switch gears. What do you do from here? You really got three options. Kind of facetiously, I put do nothing. If you want and you're comfortable with the way A and B work, you are not required to get anything else. That's an option for you. You can take Part A and B and go on your merry way. Second option would be getting a Medicare supplement. You may also know this as a Medigap plan. Those terms are interchangeable. I'm going to use them both. Medigap supplement. So you get a supplement to cover the part that Medicare A and B leaves you with, and then you get a drug card to cover your medications. And then finally, a separate route from that is a Medicare Advantage plan, also known as a Part C. Let's go over the Medigap first. So what does a Medigap do? What does a supplement do? It covers the cost that original Medicare leaves you with. I want to be clear here. People come to me all the time. They say, hey, I got to get a supplement so it covers what Medicare doesn't. A supplement does not cover any services that Medicare A and B do not cover. It covers the cost gaps that A and B leave you with. As a matter of fact, what happens here is when you go in and have a claim, you go to the hospital, you go to your doctor, that claim gets sent to original Medicare A and B first. They decide whether it's a covered service or not. If they say yes it is, then your supplement's going to have to pay the remainder. If A and B says nope, what you've had done is not a covered service, then your supplement, regardless of who you have it with, cannot and will not pay that, right? So your carrier here is not deciding what you've had done is covered. That's all coming from original Medicare. Now, if you have this supplement, you're in a route where you have very wide open access to providers. So you may pick carrier A, B, C, D, it doesn't matter. It's the same network of doctors, which is any doctor anywhere that's accepting Medicare. I put up here a Medicare assignment, right? That's your question. You accept Medicare assignment. If they do, they're required to take your Medigap. So we're talking nationwide coverage anywhere in the United States. Okay? There's a variety of plans that are available. This is what people sometimes call the alphabet soup. We will go into some details on that in a second. And then I want you to think about a very similar, not exactly the same, but a similar sign-up window for all these pieces, right? You want all of these coordinating. There are specific times and specific windows when you're allowed to enroll in all these pieces without any trouble. This piece particularly, I'm sure everybody saw the commercials last year, the open enrollment annual election period, right? We're bombarded with Joe Namath and Jimmy Walker, okay? All right, these supplements, like a Plan F, a G, and N, they don't participate in this window. There's a ton of confusion out there around that, right? So you pick a supplement, you get a Medigap, a G, later you want to change it. You either want to change your carrier or you want to change the letter, the plan letter you have. There is no open enrollment window in the future to do that. You can always try, but it will always require medical underwriting with the potential to be declined based on your health history. Typically, we'll have about 50% of our individuals that try pass, about 50% fail. So what's important here? You got to make a good decision going in because maybe you can't get out of it in the future, right, with some limited restrictions there. This route, so we're in this second route with the supplement and the drug card. This route is more expensive compared to the Medicare Advantage plans we're going to look at in a second, right? Part of the reason is your drug card is not included here. So you get a supplement to cover the medical care, then you're going to go out and get a separate Part D drug card to cover medications if you want it. With this route, though, not only is it very easy to use in terms of going to any providers you want, there's typically very little out of your pocket in terms of cost of care. This is very rich coverage typically. All right. There's our grid of currently available supplements. I think everybody understands that, right? Okay. All right, just keeping you guys awake here. All right, let's go over this for a second. Historically, the most popular plan was that one in the middle. You see Plan F. You can kind of see why. It had 100% coverage all the way down. So any cost that you were left with that A and B covered, the Plan F was going to come behind and cover all those at 100%. So it was a $0 deductible, zero copay, zero max out-of-pocket plan. You really paid nothing for your care. Very rich. So rich the government decided they didn't want you to have it anymore. So that plan was retired as of January 1st of 2020. So if you turn 65 after that date, Plan F is no longer an option for you. If you were in that plan already, you're grandfathered in, they can't take it away from you. I will tell you, for those people that have it, you probably want to try to get out. It's too expensive at this point. Okay? Plan these days, kind of our gold standard, Plan G, right? Easy to remember, G, gold. Very similar all the way down. We got one cost gap there, which is the Part B calendar year deductible. So I told you guys earlier not to write down any numbers. Now I'm going to ask you, what was the Part B deductible? Does anybody remember? $226. Okay, so still not bad. That's pretty rich. I wish I could get it. $226 you're going to pay for your medical care. So you get admitted to the hospital, you go see a bunch of doctors, you have operations, surgeries, $226 for the calendar year, then you're done. You're covered at 100% above that number, right? So still really nice. You can see there, we didn't go over this originally, but A and B, original Medicare does not cover anything outside of the United States. Part of these plans is foreign travel emergency coverage. You can see there the Plan G will cover 80% of your bill. So the way that works is you get into an emergency outside of the United States. The Plan G will cover 80% of the cost of that, up to $50,000 lifetime maximum. So it's not everything, but it's also not nothing. I mean, it is helpful. We typically, we get calls on this, and we typically advise people if you're traveling outside of the U.S., even if you have this, pick up one of those short-term travel plans, right? They're pretty inexpensive. We don't do them. There is a travel agency out in Ashland called Fellowship Travel we typically tell people to go to. They've been really great about helping our clients with that. There are plenty of other options here. As we leave the Plan G, what you're going to see is you're going to be responsible for more and more cost gaps. The next most popular option is the Plan N. Still pretty similar. You can see not only are you responsible for the Part B deductible, now you're going to pay the excess charges. So that is, by rule, a doctor can decide to accept Medicare, but then charge up to 15% more than Medicare's allowable rate. So if you have that in, you're basically getting balance billed. It's not very prevalent these days. I don't hear that a lot of doctors do that. But now you're back in the boat where you could have unlimited risk exposure. You come down with cancer, you need to have ongoing chemotherapy treatments, and your facility wants to charge 15% more than Medicare allows. I can't tell you what you could be on the hook for. Right? So for the 20 or 30 bucks you're going to save in monthly premium, I don't know if it's worth it. And then as we move from that in, you're just going to see more and more cost gaps that you're responsible for. All right, so that's the first part of the second route. We've got our medical taken care of, the A, the B, whatever supplement you decide to get, covering your medical expenses. Now we want to go pick up a Part D drug card, right? This is, again, not a piece that the government provides. So this is used in conjunction with that Medigap plan. So you're using that with A and B, with your Medigap and a drug card. All right, unlike the supplements, which are kind of standardized, right? A Plan G is a Plan G no matter who you get it from. The drug cards do not work this way. Very different here. They all have a formulary, which is a list of medications they're going to cover. They all will group those formularies into different tiers. All of those tiers will have different copays, right? So it's not straightforward as just picking a Medigap plan. Now, one nice thing about the drug cards is they can be changed. This is one of the pieces you can change during the annual election period. So you're not locked in here. During that period between October 15th and December 7th, you can look at the new drug cards that come out for the next year. You can make that change. There is no underwriting. You cannot be declined. Your new drug card starts January 1st of the next year, right? So you're not locked in. Unlike the supplements, these plans are pretty sensitive to the zip code and county that you live in. So you'll pick one based on where you live. Now let's say you move. Let's say you move down to Florida. Most likely you're going to keep that Medigap you picked. You're not going to lose it. But that drug card, not going to be eligible down there. So you'll lose that drug card based on the move. You'll have to go through the shopping again, pick a drug card based on where you live.
Can
Right.
you do that when you move, or you have to wait for open enrollment?
You can do that when you move, because that move's going to trigger a qualifying loss of that drug card. So you're going to notify your carrier that you've moved. They're going to send you a letter. You know, you're no longer eligible based on where you live. Here's when our coverage is going to end, and that letter gives you the right to go out and get a new drug card outside of open enrollment. Okay? Trick here for anybody that is thinking of moving to Florida, if you're interested in the Medigap route, get it here. The Florida Medigaps are twice as expensive. So you get your Virginia Medigap, lock in that rate here, then move to Florida. Okay? All right. Drug cards are going to seem very confusing here. I'm going to really get in the weeds. So coverage is not straightforward in terms of how a drug card is going to cover your medication. There are different phases. So deductible phase, right? Everybody knows what a deductible is. It's an amount that you pay up front before the carrier starts paying on your behalf. There's deductible this year is $505. That's the legal limit. Most of the drug cards do bump up right up against that. There are a few that don't. But we've got this a deductible phase, then an initial coverage phase, then officially the coverage gap, or what's unpopularly known as the donut hole, and then the catastrophic coverage phase. Okay, let's step through these. You got your deductible. You're going to pay whatever the drug costs until that deductible's met. Not all drug cards have a deductible. Some of the more expensive ones do not. Not all of them make you meet the deductible for all the tiers. So maybe a drug card will give you tier 1 and tier 2, no deductible. Tier 3, tier 4, you're pretty much going to have to meet a deductible first. So let's say you've met the deductible. Now you're in this initial coverage phase. For most meds, This is when you're used to, I'm going to my CVS, I'm going to Walgreens, I've got my $10 copay for this, my $20 copay for that. Everybody's relatively happy. You're chugging along. Now, the amount that you have spent plus what the drug company spends on your behalf, that hits $4,660. You're out of your initial coverage phase, and now you're into the donut hole. And what has happened here, you've seen your medication costs go up because your copays are gone. Now you're paying 25% of the cost of the medications for both brand and generics. Okay? You're going to be in that donut hole paying those percentages until you hit $7,400. I'm going to go back for a second. To get into the donut hole, it's the amount that you spend plus what the carrier spends on your behalf. To get out of the donut hole, it's just what you spend. That's nice. All right. Let's say you hit that, though, and now you're out of the donut hole and you're into this catastrophic phase. That sounds great. Okay. What happens here? You do see your cost of your medications go back down. So now we're dealing with flat copays and small percentages again. Okay? So your medication coverage can be a bit of a roller coaster. It can start low, you get the donut hole, peaks out, goes back down if you hit the catastrophic phase. So it isn't necessarily like, hey, I go January, my meds were $25, that's what it's going to be through the end of the year. Doesn't work that way. Right? Yes, sir?
Is there any maximum per year?
Not currently. So the question is there any maximum on the amount you could pay for your drugs? And the answer to that today is no. That is changing. So is it 2024 or 2025? 25. So in 2025, there was some legislation passed. 2025, there's now going to be a maximum out-of-pocket on all these drug cards. $2,400? $2,500? Anybody know? $2,000, right? So $2,000 you spend out of your pocket for starting in January 2025, then you're going to be done with your medication. Yes, sir?
I got a question off Zoom. You mentioned the Florida thing. What about people? I'm assuming drug card is based on your legal residence. So let's say somebody goes to Florida for 5 months out of the year, but they live in Virginia the rest of the time. How is the drug card?
So the question is regarding if you have multiple residences, where can you get your drug card out of? As far as I'm aware, if you've got a legal residence somewhere, I don't know if it has to be your main one, you can get a drug card there. Tammy, Melissa, have we ever had you guys ever, any feedback on that, right? If somebody's got a residence here and they've got a residence in Florida, they can pick and choose where they want their drug card to come out of.
One's cheaper than the other then.
The prices can be very different. The drug card's not as big of a deal as these supplements. Some of these state supplements are significantly more expensive than what we have here in Virginia. Virginia is a pretty attractive state for the Medicare, Medigap plans. All right, so I made drug cards confusing and scary. Let's see if I can clean it up a little bit for you here. So there's a search tool, Medicare.gov. Everybody's welcome to go there. They've got a plan finder. So we'll do this for you as a broker, but you can go there yourself, type in all your medications. It will search all the drug cards. It will tell you what the right drug card is from a total out-of-pocket cost standpoint. So it adds up the premium of the drug card, then all the costs for your medications for the remainder of the year through all these various phases, and it will tell you what the right drug card is for your situation. Okay? So you get your drug card. Now we're in the annual election period, October 15th to December 7th. You want to change that, you can hop on that tool, enter in all your meds, change your drug card for the next year. Okay? So it takes that actual medication list and your pharmacy, because these drug cards all have their own pharmacy networks. So it takes those two things into account and tells you what the right one is. Right? So you can get an idea of what your expected costs are going to be going into this, at least for the medications you know about. Okay? Yes, ma'am.
What if a doctor prescribes a certain medication and there is a generic for it, but the doctor says, I really would prefer, my expert opinion, I want you to take drug A, not the generic. What happens with the filing of the claim and and what's paid through the process?
Yes, good question. So the question is, what happens if you're prescribed a medication that is a brand? So your provider, your doctor, wants you on a brand drug that has a generic equivalent. I can tell you that's a difficult situation. So out of the box, most drug cards do not want to cover a brand drug if there is a generic equivalent, okay? So for the vast majority of them, they're just going to say, no, that is not covered. I've seen some examples where they're changing that. Synthroid, right? So Synthroid, that brand drug can be covered by some drug cards out of the box. Don't ask me why. I don't know why. But for most of them, if there's a generic equivalent, the brand is just not going to be covered. Now, you get into that drug card, you've got some options, right? You can always change it every single year, but let's say you get in it, now you're prescribed this brand drug, do an appeal. Okay, so your drug card has to allow you an option to appeal the decision. So they say, no, we offer this generic equivalent, but you get with your doctor and say, hey, we tried her on this generic, here's what happened, and here's why it's not working, here's why she needs the brand. You've got a chance there. Okay. Now, if the doctor just says, hey, I prefer the brand, no. There's got to be a reason. But at least there's an opportunity to get that med covered. Yes, sir?
Another question on Zoom. Can you just speak to like drug card versus inpatient medicines that are given, while you're in the hospital? Make sure that people understand the differentiating between those two.
Yes. So the question is in regards to medications you're receiving as an inpatient versus medications that would be covered by the Part D drug card. So while I can't say for sure, because there's always these procedure codes that, whatever the doctor's using there, but for the most part, if you're having medication administered in an inpatient facility, that should be covered by A and B and then your Medigap. What we're talking about here with a separate Part D drug card is really going to your local pharmacy or your mail order, right? Yes, sir.
Can you speak to the practical effect of this choice insulin? And I'm a little bit confused on what the government did when it's going to roll that.
So the question is regarding to the insulin savings program. The government actually rolled that in January 1st, so it started this year. So the drug card carriers are required now to cover is it the generics or is it both generics or the brand? I'm not sure, but they have to have alternatives for insulin, injectable insulin, at a $35 copay? $35 copay. Okay?
And that doesn't matter which of the...
They are, yeah, the question is, does it matter per drug card? It is not supposed to. So every drug card is supposed to have some of these insulin alternatives at that $35 copay. Injectables. Okay? Yes, sir. Thank you. Okay, we're done with the second route. We've got our Medigap, we've got the drug card. Now we're going to talk about high-level overview of the Medicare Advantage plans. Very different than what we just went over. This is your third route, right? Do nothing, number one, Medigap and drug card, number two. Now we've got Medicare Advantage plans, also known as Part C. They really hammered you with these commercials over the last quarter of last year, right? This is what they want you in. So what happens here? We're replacing original Medicare in terms of how your claims are going to be paid. So you still have to have A, you still have to have B, you're still paying the government their portion along with any high income adjustments. But now you've outsourced your care to the private Medicare Advantage plan. So your claim's no longer getting sent to A and B. They're no longer deciding if what you've had done is a covered service. That is all done through the private carrier at this point. One thing about that means that you could get some services that original Medicare is not covering with this. So think about those things I mentioned: dental, vision, hearing aids, Meals on Wheels, the transportation question that was asked earlier. Right? You need a ride to your doctor for a routine visit. That can be thrown in here. We've got Medicare Advantage plans that are now given monthly grocery cards. We got some that are paying your electric bill. It's crazy what they're doing, right? So all these extra benefits to get you enrolled in these Advantage plans. So that's one thing people can like: extra services. Now, you are in a specific carrier-defined network of doctors here. So with that second route, Supplement Medigap, drug card, really go any provider anywhere as long as they take Medicare across the U.S. With these Medicare Advantage plans, you are in a defined carrier's network, usually fairly localized, to your service area. Okay? So your access to providers has shrunk here. These plans are a little more cumbersome to use in terms of getting your care. Okay? They also come with cost on your side when you go in and use the medical care. So deductibles, co-pays, co-insurances, right? With that Medigap, you pay, pick your plan, pay a little bit, and then be done. With these Medicare Advantage plans, every time you go in for a visit, you're going to pay a copay. You get admitted to the hospital, there's going to be a daily copay. You go in for chemotherapy, they're going to charge you 20%. So you'll pay for cost of care as you go in and use it on these Advantage plans. Okay? Most of the Advantage plans we will deal with will have a drug card built in. They don't always, but most of them do. So you don't have to go out and get a separate drug card. In most cases, you can't. So drug card's built in. Again, very similar sign-up window to original Medicare. There's some tricky rules regarding this, but if you get it all at the same time, you'll be fine. So we got a trade-off here. What are we doing? We're getting lower monthly premiums, so the Medicare Advantage route is not as expensive in terms of monthly premium as what that Medigap and drug card is going to be. So we're getting lower premium, we're getting some extra services, but what's our trade-off? We're going to stick to a specific carrier network, and we're going to pay cost of care when we go in and use the plans. Okay? Now, rate increases, typically not as frequent or as large as what you're going to see on the supplements. So those Medigaps are going to go up every single year you get older. They're age-based products. Every single year they're going to get more and more expensive. These Medicare Advantage plans, as long as I've been doing this, I've had options that were $0 premium. Okay? So your monthly cost of insurance is lower here. So you got that trade-off. Just like the drug cards, the Advantage plans can be changed year to year. So again, during that annual election period, you picked Carrier A's HMO. Now your doctor's dropped out. You need Carrier B's PPO. You can use that window. You can switch a plan. New plan starts January 1st. No underwriting. You're good. Okay? Just like the drug cards, again, these plans fairly sensitive to where you live. So you get an Advantage plan in Virginia and you move to Florida, you're going to lose that thing. You're going to have to re-enroll in a Florida-based Medicare Advantage plan. And then I put a note here. So the plans may not offer out-of-network benefits unless you're in an emergency situation, right? So let's say you're traveling. You have a Virginia-based plan. Now you're visiting Florida. You get into an emergency. The plan technically is supposed to provide you coverage as if you're in network until you're stable enough to be moved back to your service area. Put there, as defined by the insurance company. I had a colleague in this business who had a client go to Texas on an Advantage plan, got bit by a rattlesnake. I guess the fool thought it was an emergency, declined, right? So that's the kind of thing you gotta be aware of. Again, just a little bit more cumbersome to deal with on these, all right?
So if you feel that, who would review it?
So it starts with an internal review by the Advantage plan, and then you can end up filing a grievance with Medicare itself. Yes, sir?
So in that case, those charges wouldn't go to the maximum out of pocket?
So the question is, would the charges go to the maximum out of pocket? So if they approved it, if they approve it, they will go toward the max out of pocket. If they don't, then it would not be a covered service. So your costs for services that are not covered do not go toward the max out of pocket. Yes, sir?
Are there restrictions for moving from Medigap to Advantage and Advantage to Medigap back and forth?
Good question. So the question is your ability to move between the Medigap route to the Medicare Advantage route. So here's how that works. If you're in the world of the Medigaps, you can move to the Medicare Advantage plan during the annual election period each year. So you can drop that Medigap, guaranteed issue during the annual election period. Your new Medicare Advantage plan starts January 1st. If you're in the world of the Medicare Advantage plan and you want to move back to the Medigap, it's typically going to require the underwriting with the potential to be declined. There are a few exceptions to that. If you go into an Advantage plan when you're first eligible for Medicare, so you pick up your Part A and Part B, they start on the same date and you turn 65, they'll give you 12 months to try the Advantage plan out. Anytime during that first 12 months you decide you don't like it, you can move over to the Medigap with no problem. After that 12 months is over, all bets are off the table. Okay?
On the Advantage plans, I've heard that when you go to the hospital and you need rehab, you also get less days of rehab. Is that true? They have all these different criteria that are much stricter. You can say you need 120 days of rehab at a rehab center. They're only going to pay for 30.
Yeah, so the question is, how do the Advantage plans handle the limits on the rehab centers? You're absolutely correct. This is way more cumbersome to deal with, and that is the perfect example of most of the complaints we get on the Advantage plans, which is that I need, skilled nursing for a certain number of days, or I need this rehab therapy, and those Advantage plans are...
That's why they offer all this other stuff, because they're going to cut it off on the other side.
That,
What they do is they offer you all these hearing aids, all this other stuff, exercise programs, and then they're going to screw you on the other end.
They are inherently more difficult to deal with.
When you say that, when you're saying that, I'm interested in this. So, are you saying that relative to Medigap, which would be covered under Medigap?
Yes, sir. So the question is, relative to Medigap, would those services more likely be covered? Absolutely. Okay.
So if you don't get in up front on Medigap, you take Advantage first, then you have to get, and you go past that time domain you talked about, you have to get qualified, you have to get basically signed off in order to have a shot at that.
That is correct. So the question is, if you're in the Medicare Advantage plan world and you don't move to the Medigap within that first 12 month, they call it a trial right, and you want to move after that, yes, you've got to medically qualify. So you'll fill out a medical questionnaire. The carriers will pull your health history, and they'll decide on a case-by-case basis whether they want to accept you. Okay? Another exception to that could be if you're in a Medicare Advantage plan, let's say in Virginia, and then I'll go back to moving, right? You move to Florida, you're going to lose that Medicare Advantage plan due to the move. Now you've got an involuntary loss of previous coverage. You can get on the Medigap that way. I've had somebody do that just to get out of the Advantage plan before. They moved to North Carolina just for that reason.
And then I moved back. and that qualified as an event to allow them to get into that.
Yes, sir. Oh, there are some loopholes, yes. Okay, so this annual election period, October 15th to December 7th, that's your window to change the drug card, to change your Advantage plan, or to leave the Medigap world and sign up for a Medicare Advantage plan. That's your window. So you do it during that time frame. New plan starts January 1st. No underwriting. You cannot be declined. Health history does not matter. Okay? Again, driving home, supplements, Medigaps, they do not participate in this window. If you take nothing else away from this class but that, take that away. All right, let me give you just a couple of cost examples here. Yes, sir. Oh, supplements do not participate in the annual election period, right? Okay. Just a couple cost examples here, just to give you guys a ballpark idea of what a move to Medicare could look like. So here we've got Part A. We've said that's $0 premium. Part B, the standard $164.90. I'm assuming no high income adjustments here, right? That could go higher based on your income. Gold standard for a supplement, you pick a Plan G. Most of those are running here in our area somewhere around $100 a month, give or take. Again, these are age-based, so that's a 65-year-old, anywhere from $90 to $110, depending upon where you live, male, female, household discount. There's a few criteria that will go into that, but $100 is a good ballpark for a 65-year-old. Part D drug card, quite honestly, 25's probably a little high. Most of our clients end up with a drug card less than $20. Okay, so total move to Medicare here, looking at $289.90. So this is the richer, what I would consider the richer, easier to use route. Go where you want to go, pay $226 on medical costs and be done. So without high income adjustments, you're a little less than $300 a month. Again, per month, per person. Add in any high income adjustments you're going to be eligible for. Medicare Advantage route, again, Part A, $0. Part B, $164.90. And then the Medicare Advantage, I said we got plenty of those that don't cost anything. So you can get a $0 premium Medicare Advantage plan. So your monthly premium here, cost of insurance, is just whatever you're paying the government for Part B anyway. As long as you don't need
So a
it.
difference of about $140.
That's pretty accurate, yes, sir.
But you can move from the supplement to the advantage with no underwriting.
So the question,
Can't go the other way without underwriting.
that's correct, yes. So the question is, again, what is our cost differential here? So we've got, what, $130 or so, $130, $140 more a month to go the supplement route versus an advantage plan. And then to reiterate the point, how can you move? So you can be in the world of the Medigaps and then move to the advantage plan with no problem. If you're in the advantage plans, you're typically going to have to be approved through underwriting to move to the Medigap. Did I answer that question for you? Yes, sir. Yes, sir.
Just in general, like, how much more is a 75-year-old going to pay than a 65-year-old for that Medicare supplement?
So good question. 160-ish, probably a good ballpark. I would say a 75-year-old might be $150 to $160 instead of $100.
Okay.
Tammy, does that sound about right?
Yeah,
That's right.
that was 74 and GG at 128.
So it's not a big jump every year.
Not a huge jump. Let's go over the 2 rate increases for your Medigaps, though, because there's an age-based rate increase. So every year you get older, they're going to charge you more based on your age. But then also the product can also increase. So they'll take the whole rate grid and then jump that up a percentage. Okay.
And that happens every year, you said, pretty much.
Typically, yes. So guarantee the age base is going to happen every single year. It's not a guarantee on the product. I would say about 3/4 of the years we get a product base increased. Doesn't happen all the time, though. Yes, sir, you had a question.
Just out of curiosity, so the Medicare Advantage plan has a 0 premium. Why does the insurance company offer it? How do they get paid?
How they get money?
Yeah. Okay, this is the peek behind the curtain for the dirty secret here. What's happening? All right, remember what's, sorry. So the question was, how does the Medicare Advantage plan offer a $0 plan? Okay, think about what's happening here. Medicare A and B has outsourced your care to the Medicare Advantage plan, so they're not dealing with you anymore. And in order for the Advantage plan to want to deal with you, they're going to charge the government a fee each month. And I think it's $800 or $900 a month. So when somebody signs up for this $0 Medicare Advantage plan, the government's paying the chosen carrier somewhere between $800 and $900 a month to handle you.
Is that a one-time?
That is monthly. That is monthly.
That is
That is a monthly reimbursement.
That's why there's so many commercials.
That is why there's so many commercials. Okay? All right, guys, I really appreciate the opportunity to have given this class. There's all my contact information. I've got 1 quick minute here on my role in all this. So I own a health insurance agency. We specialize in nothing but health insurance and Medicare. We are an independent brokerage, so we're appointed with, I'm sure, every carrier you've ever heard of. Our goal is not only to provide this education for you, walk you through the process, right? So as you're making that transition, when do you need to be enrolling in Medicare? How do you need to be enrolling in it? How do you do that? So we act as a guide to make sure you get A and B done right. Then we work with you to understand your situation. So doctors, you need to make sure stay covered. Medications you're going to be on. Pharmacies, you got to keep in network. And we go out and we shop out all these various routes for you. We put a proposal together, put that in front of you, explain those in detail. You pick what you want to enroll in, and then we handle the enrollment process for you from that point forward. Right? At that point, once you're enrolled, we are your first point of contact. So you ever need to do something as simple as changing your address or updating your bank draft, or you got claim issues, you're calling us instead of the carrier. Our help is completely free. So I mean, there are no direct charges you're going to pay to us as a broker. Price of whatever plan you want from whatever carrier you choose to get it from is going to be the exact same as if you do this on your own. So find some help. You don't like the way I look and sound, go find a broker you do like. They can make your life easier, okay? All right. Appreciate it again. I'll have some cards up here if you guys want to grab them, and thanks for your time.
Okay, thank you. Just thanks again, Chris. Appreciate your time. I'm sure if you've got individual questions, Chris will hang around a little bit. Got his information. If you leave here and forget it, contact us at Heartwood. We'll get it to you. And again, thanks everybody for coming. Appreciate it.